Welcome back to Good Day Atlanta. Last week, the CDC confirmed 75 new cases of measles. That brings the total number to 836 cases across 23 states, with a handful of them here in Georgia. Now, that led many of us to wonder whether we might need a measles vaccine. The Fox Medical Team's Beth Galvin is here now to talk about this. And Beth, that number just keeps growing.
Yeah, and it's really interesting because Georgia is one of 10 states or areas experiencing a measles outbreak, and it's a highly contagious virus. That's the problem. Measles is still very widespread in Europe and Africa and Asia. So if you're planning to travel this summer overseas, you want to make sure you're going to be protected. At Highland Urgent Care and Family Medicine, Dr. Nicholas Bolio specializes in travel medicine. So usually his patients are flying off somewhere exotic and want to get vaccinated against illnesses common in far-flung areas. But recently, that's changed because people are talking about the MMR, or measles, mumps, and rubella vaccine.
Now we're seeing a lot more people who come just to get the measles vaccine being aware of excess measles cases in other countries. So that has become a small but growing portion of the population who seek vaccines at our clinic.
If you're planning to travel internationally this summer, Dr. Bolio says you too need to get protected against measles, even if you're just going to Europe.
So Western European countries like Italy, France, England to a lesser extent have had large anti-vaccination movements and have subsequently developed a reservoir of measles.
So who else needs the MMR vaccine? That depends on your age.
If you were born before the year 1957, it's assumed that you've already contracted all of these infections, so typically that population is not recommended for vaccination.
The CDC recommends children get their first MMR shot when they're 12 to 15 months old, another when they're 4 to 6 years old.
The people at highest risk for measles are the unvaccinated population. We typically do not give the first measles vaccine until after a child is older than 1 year, so they are particularly susceptible.
Mothers can pass along some immunity to their newborns. And if you're a teenager or an adult and you're not sure if you've been vaccinated against measles, the CDC recommends getting 2 doses, 28 days apart.
But additional doses will not cause any further problem. So if there is any issue about getting vaccinated, whether you think you should or should not, it will not be detrimental to receive an extra vaccine.
And Georgia has had 6 confirmed cases of measles this year, according to the State Department of Health. All of them involved members of 2 families, and that is compared to only 6 cases in the last decade and a half in Georgia. And health officials say if you're not vaccinated or you're really not sure of your status, you do want to talk to your doctor about your options. Ron?
Yeah, a lot of good information there. What is the risk level when it comes to measles, though?
So I would say in Georgia, the risk level is extremely low right now, but if you're going to be traveling internationally, it may be a little bit higher. It's still probably going to be pretty low, the chance of you getting infected. That said, if you're not protected and you do get exposed to measles, there's almost 100% chance, Ron, that you will contract the virus. Yeah. That's how contagious it is. Yeah. That's why it's an issue.
Sounds like it's better safe than sorry, right?
Yeah, perhaps.
All right.